Thank you everyone for joining us for our third annual National Public Health Week event. We will be having a conversation with y'all and letting everyone know just what it is we're doing in public health, introducing to the staff, and we are looking forward to talking about ourselves. So as you can see on the agenda here, we've got introduction and roles where you get to meet the awesome public health staff, an overview of the ISD narrative for the Public Health Division, future events, and questions and comments, but you could leave those in the comments section. And so we have myself here, Norris Guscott, which is the Public Health Coordinator and Chair of the Food Policy Council.
My name is Malika Champagny. I'm the Community Resource Coordinator.
My name is Damiani Garrido, and I'm the Grant Specialist.
My name is Kitsia Diaz. I'm the Lead Public Health Nurse.
My name is Irini Camarinos. I'm the Epidemiologist.
And my name is Candace McClory. I'm the Substance Use Coordinator and Community Liaison.
And we'd be remiss if we did not mention our brave leader, Director Lisa Tobin, who isn't here at the moment. Here we have the Inspectional Services Department, of which the Public Health Division rests under, because technically we are a division under ISD. And here are some of the numbers for the work that we're doing.
The Inspectional Services Department Public Health Division's mission is to prevent disease and injury, encourage access and inclusivity, promote health and wellness, and prepare and respond to disasters. The Public Health Division accomplishes this through assessment of the social determinants of health, through partnerships with various community organizations, via grant vetting, application, and receipt, as well as through assessment, implementation, and evaluation of community health programs. In addition, the Public Health Division acts as a technical advisor to the Board of Health, which consists of a 3-person board appointed by the mayor. The board serves in both a judicial and legislative matter, including hearings for health license suspensions, as well as directing local policy, such as the Environmental Tobacco Smoke Regulation Program.
My name is Malika, and I'm the Community Resource Coordinator. My main role is to coordinate a variety of health resources in our Community Health Resource Room for community members and promote health and outreach efforts in community-based settings. Resources that we provide in our resource room range from food, housing, substance use disorder, and general health.
Hello, my name is Damiani Garrido. I am the Grant Specialist for the Public Health Division. My main role, I mainly work hand in hand with Norris Guscott, where we develop and evaluate partnerships to support grant-funded activities and initiatives, as well as collaborating with community members and organizations to implement evidence-based programs and projects. Together, Malika and I in the Community Health Resource Room, we offer free items such as sharp containers, masks, as well as resources and educational literature. Our goal is to create an inclusive and open space for community members while providing a variety of resources from local, state, and national organizations. We hope to become a resource hub for community members.
During the fiscal year 24, we had 2,031 people visit the resource room for a variety of reasons. We also attend events all throughout the city, providing free resources and giveaways specific to the audience we are serving. Public Health Division is always willing to attend any community events in the city. We also provide monthly newsletters and monthly health board presentations dependent on the health theme for the month.
My name is Kitsia Diaz. I'm the lead public health nurse for the Public Health Division. I do a variety of different things. So I can talk first about the TB patient care that's in the middle of the screen. And so in FY 2024, me and the other public health nurse, MJ, had directly observed treatment for 13 active cases of TB. And the other number here, 831, is the total number of TB infection cases. So this includes people who are just getting more work up for TB. So what that entails is basically they would get further testing for a diagnosis and would get treatment if needed based on the diagnosis. And so the number one thing that we do for TB is making sure that the people that we see are not infectious during the entirety of their treatment. We do contact tracing to make sure that anybody like household contacts or any contacts at all also receive full treatment if needed. We also ensure complete treatment for all active cases and their contacts. And then for anybody who has latent TB, which is when they have the bacteria but not showing any symptoms and are not infectious, meaning it's just in their system but not actively causing disease, they can also receive treatment. And so that's a lot of what we do for TB patient care. And then if you look on the left side of your screen, it talks about the flu vaccines that we did. And so for the flu season 2024 through 2025, we did 17 clinics in between the months of October and November. And then after that, we held open like Tuesday night clinics as walk-ins. And we did a total of 365 flu vaccines. On this slide, it breaks down the flu data for the season 2024 through 2025. And what we can see is we gave 293 total regular dose. So that's anybody 6 months and up and through 64 years of age. And then 72 high dose. So that's 65 and up. And we also gave 287 people that we gave vaccines to had some form of insurance, while 78 did not have any insurance. And then it also breaks down into female versus male. And we did 214 female and 151 male. And lastly, the last section is by age. And so 308 people were at least 18 years or older, and 57 were less than 18 years old. And so the benefit of breaking it down like this is we can see, who are we targeting with our vaccines? Are there populations that we're not reaching? Where we can see we only got 57 kids. And so how we can plan for future flu seasons is looking into how we can have more access for flu clinics for younger kids and for older adults. And so it just helps inform how we would prioritize areas for giving the flu vaccine.
My name is Irini Camarinos, and I'm the epidemiologist in the Public Health Division. The Department of Public Health at the state level has 76 reportable communicable diseases that are reported to the local Public Health Division, and that is where I work. Primarily, that is my space. I see the cases in the Massachusetts Virtual Epidemiological Network, also known as MAVEN. In fiscal year 2024, there were 3,345 diseases reported. Of those, 1,712 cases were reported for novel coronavirus, 1,477 cases were reported for influenza, and 66 were reported for foodborne illnesses, which includes cases for salmonellosis, campylobacteriosis, calicivirus, norovirus, as well as others. In addition, there were 42 cases for hepatitis B and hepatitis C, and 17 cases of Group A strep. My work also revolves around emergency preparedness. During fiscal year 2024, the Public Health Division worked closely with the Lynn Fire Department Emergency Management Director, Kevin Wilkins, on applying for and receiving a technical assistance grant to update its emergency response plans, host a workshop for various city departments involved in emergency response, as well as a tabletop exercise to offer a real-life scenario for practice. Currently, in April 2025, we are working with the current Emergency Management Director, Michael Smith, to conduct a drill at Breed Middle School. And that will involve a number of departments in the city that would be activated in the event of a weather or other emergency, and see how we can assemble resources on a timely basis in an emergency situation to open the shelter for residents that would need a place to be in if they cannot stay at home.
My name is Candace McClory. I am the Substance Use Coordinator and Community Liaison in the Public Health Division. We currently host 3 youth prevention grants spanning through the ages 3 to 24. Through those grants, we have done a variety of different things. We have held the Youth Health Risk Survey in middle school and high school, which measures youth protective factors as well as risk factors. We have done the Photo Voice Art Project, which engages middle and high school students in thought-provoking interpretations on their meaning of topics related to prevention. We have currently done that with 4 after-school programs. We have done the I Can Help trainings with local school and after-school providers to establish safe places for adolescents to develop a trusting rapport with adults in the community. We've also have started a pilot program at NAGLI where we're administering young adult risk assessments to determine the risk level for participants at NAGLI. We also have provided trainings through Boston Children's from the Brazelton Touch Points to local early education staff and providers. In addition to hosting 3 youth prevention grants, we also provide support to the opioid working group established by Mayor Nicholson in implementing actionable items throughout the city in support of the reduction in opioid-related illnesses and deaths. Through the opioid working group, we have placed 5 naloxone boxes across the city. And since fiscal year 24, we have distributed over 625 Narcan boxes, and 130 people have been trained in using Narcan in overdose education. Additionally, we have placed 2 syringe kiosks in the area of Willow Street and Washington Street. Through those kiosks, we have collected a total of 473 syringes. In January of 2025, we placed a health and wellness vending machine on Blake Street, which has distributed 284 various items, including hygiene kits, wound care, hats and gloves, and Narcan since January of 2025. Through the opioid working group, we also distributed 9 organizations a total of $247,000 through our NOFA grants. And through those grants, we have been able to provide support for 179 individuals. With that support being provided, 51% of that was towards personal care support. Personal care includes gift cards for food, clothing, household supplies, and hygienes. 17.4% of those funds were used to provide people with transportation. 24% of those funds were used for medication safety. And 6.3% of those funds were used for housing and utility assistance.
My name's Elaine D'Agostino. I'm the administrative assistant for the Public Health Department. I handle the billing, the invoicing, the grants for the department, as well as any ordering, products, daily assistance for the staff, coordinating events, coordinating with any and all areas of public health as needed with Director Lisa Tobin, Inspectional Services Coordinator Norris Guscott, as well as the additional staff.
The Public Health Division aims to be in the community as much as possible through events sponsored around the city. We have a public health van with our mural that is also in the Community Health Resource Room of Room 103 at City Hall. Be sure to check out our van when you see it at events and look out for our table. Our next event is at the Demarcus Family YMCA for Healthy Kids Day on Saturday, April 26th from 10 a.m. to 12 p.m. noon. The American Red Cross will be in the Community Resource Room 103 at City Hall for the blood drive on Tuesday, April 29th from 1 p.m. to 6 p.m. As the spring and summer months roll on, we usually attend more outdoor events, so be sure to check our Facebook page and website for more information on where we will be next.